Hello, my name is Chelsey Nicole Taylor, and I am here to speak with you about sudden sensorineural hearing loss. My patient was a 15-year-old male with a very positive attitude despite what was going on with him. He was experiencing sudden sensorineural hearing loss in his left ear. He was assisted by his parents, and he did have a family history of hearing loss from his paternal grandmother who had hearing loss due to noise exposure. The patient and his parents both reported that he began to complain of hearing loss and sounds being muffled in his left ear after suffering from a virus. He also expressed that he is experiencing tinnitus in the left ear that is audible over moderate noise, which tends to be pretty bothersome to him at times. Here are his audiograms from his initial visit all the way to his most recent visit, which was in April 2021. As you can see, there is a very significant change in that left ear. As previously stated, the most drastic change from his initial encounter to his most recent visit was his drastic change in hearing in that left ear. During his initial visit, his results in his right ear was hearing within normal limits with excellent word understanding at a normal conversational level. And in his left ear, he had a mild sensorineural hearing loss with excellent word understanding at a normal conversational level. Now, during his most recent visit, in his right ear, he had hearing within normal limits with excellent word understanding, which was stable from his initial visit. However, in his left ear, he had a profound sensorineural hearing loss, and his speech could not be tested due to the audiometer presentation level limitations. As far as his diagnostics and treatment, this patient's hearing declined very fast. At his initial visit, he was prescribed prednisone and informed that if his hearing did not reverse with oral steroids, a transtympanic injection of Decadron would be considered. Due to the fact that his hearing continued to decline, the patient received 3 rounds of Decadron injections. After receiving treatment, I noticed that this patient's hearing did become stable for a few months and later took a turn for the worse. The physician remained hopeful that his hearing would come back and explained to the patient that if his hearing does not come back, that there's nothing more that he can do after that 3rd Decadron injection. After receiving the injections and taking the prednisone, his hearing continued to decline, and he was later referred to an audiologist to talk about purchasing a hearing aid for that left ear. The patient's parents, purchased a Phonak Audio M90R for him. Initially, he had a great experience wearing his hearing aid. Although there were some issues with the school system not wanting to order an FM system so that he could further succeed in school, however, after obtaining the proper paperwork, my preceptor and I were able to write a letter and take the proper steps so that he could have an FM system due to it being an essential part of his success in school. Unfortunately, due to the fact that he is now experiencing no hearing in that left ear, he no longer uses the hearing aid. He is now a cochlear implant candidate for his left ear and was referred to Emory Hospital to discuss next steps with the surgeon. Why is this case relevant? This case was relevant for so many reasons to me. Sudden sensorineural hearing loss is a rapid loss of hearing all at once or over a few days. This happens because there is a problem within the inner ear or the auditory nerve, which makes this a permanent hearing loss. This particular case is relevant because when people experience this type of hearing loss, they often wait to go to the otolaryngologist due to the fact that they feel that their ears may just be plugged with wax. However, many don't know that if this is not addressed or seen about immediately, treatment such as steroids and Decadron injections will no longer benefit the patient. In this particular case, after the patient received the injections, his hearing was stable for the next couple of months, and he received hearing aids as a result of this. As previously stated, his hearing quickly declined and is now profound sensorineural hearing loss in that left ear. This means his hearing aid no longer gives him any benefit, which is what led to the audiologist to recommend a cochlear implant in that left ear. We are hoping that he goes and he follows through with getting the cochlear implant, because we do feel that he would gain tremendous benefit from having a cochlear implant in that left ear. Thank you so much for listening to my case, and I hope you found this patient to be just as interesting as I did. Again, thank you.